Thank you. So now I'm going to move to my other colleague, Liz Hartnett, who is one of my colleagues in nursing, and I'm so happy that Liz is here to talk about her work. Liz is actually teaches in our program in intellectual disability and has for quite a few years, and she's been working on her PhD, of which she's giving us some discussions about her interesting discourse analysis about teaching nursing students, a topic that I find really, really interesting, but teaching them specifically about intellectual disability, which I think is a fascinating and important area for us to all learn about from a qualitative perspective. So I'll turn it over to you, Liz. Go ahead.
Thanks very much, Tanya. Can you hear me okay?
Yep.
Yeah, loud and clear.
And can you see my slides?
We can indeed, yeah.
Great, thanks very much. Okay, so I'm delighted to take part in the Qualitative Research Matters proceedings today. And I'm going to look at, following on from, I think Colm looked at an aspect of critical discourse analysis. I'm also going to look at critical discourse analysis and how it can shed light on aspects of nursing students' access to knowledge and knowing for practice. So I'm first going to set the context of intellectual disability nursing and its education in Ireland. I'll then just look briefly at my PhD study and the focus for today's talk. I look at my conceptual framework, and then the methodology I used was critical discourse analysis. And I'll finish with findings and implications for practice. So my PhD is entitled An Exploration of How Undergraduate Intellectual Disability Nursing Students are Supported to Access, Integrate and Apply Knowledge for Practice in Irish Higher Education. So today I'm just going to look at how students are supported to access knowledge to build their ID, intellectual disability or ID nurse disposition. Okay, so a bit of context. ID nursing has only existed in Ireland since the 1960s. It started as an apprentice style training where nurses were specifically trained to care for the person with an intellectual disability in an institutional setting. So there were large numbers living in ward settings, and it was similar to a general hospital. But almost as soon as ID nursing training started, and every decade since, ID services have been working on the move from institutional care to a community-based setting for people with an intellectual disability. So intellectual disability nurses have had to be flexible in responding to the health and social care needs of people with an intellectual disability in this constantly changing service landscape. So some important themes in ID nursing today are an evidence-based approach, health, person-centered and lifespan approach, advocacy and support to access mainstream services, quality of life, and addressing a large and expanding collection of health and social care needs. So the flexibility and addressing the large collection of needs means that there can be role confusion and ambiguity in relation to the attributes of the ID nurse. So this exists in ID nursing, and it also exists in ID nursing education. So we moved from the apprentice style training to higher education with the first degrees in nursing starting in 2002. There are currently 8 degree programs in ID nursing in Ireland, and Ireland and the UK are currently the only countries to provide undergraduate degrees in intellectual disability nursing. So I had thought for a number of years on one of the ID nursing programs, and I had noticed students struggle to develop their RNID attributes. So all the ID undergraduate programs have a very large curriculum, and they have a large collection of theory and practice elements to integrate for their nursing practice, and they struggle to integrate knowledge to form a clear understanding of the RNID disposition and attributes. So I looked to existing research to see how I could research this topic. And I identified legitimation code theory, which had been used to explore dispositions in many practice-based disciplines. And LCT and critical discourse analysis had previously been used to study identity in academic nursing. So I used both LCT and CDA in this study. I will just talk about LCT briefly before I move on to CDA. So LCT is described as a multidimensional toolkit where each dimension offers concepts for analyzing a set of organizing principles underlying practices as legitimation codes. So it was developed by Carl Mayton in the University of Sydney. So I think this is the second time this morning we're getting knowledge from Australia. Carl Mayton built on the sociologists Bernstein and Bourdieu's work. It's used extensively in Australia and South Africa, but also internationally. It's aligned with social realism, which emphasizes that knowledge is not only socially constructed, but is also real with real structures, properties, and effects. So it allows for the shedding of light in disciplines and understanding of coding orientations within disciplines. So there are several LCT codes and the most suitable is chosen for a particular study. Today, I'm just going to look at the specialization code because I'm interested in understanding about the attributes of the ID nurse. So each LCT code has a Cartesian plane where practices in a discipline can be plotted to understand coding orientations better. So in this Cartesian plane, we have on the vertical axis epistemic relations, which in this study are the relationship between ID nursing and its knowledge base. So they can be relatively stronger or relatively weaker. And on the horizontal axis are social relations. So in this study, these are the relationship between the ID nurse and the person with an intellectual disability, and they can be relatively stronger or relatively weaker. So the specialization code and the rules of the game in a particular context are described by specialization codes, emphasizing what you know about and how. So that's a knowledge code. The kind of knower you are, that's a knower code. Both is an elite code or neither is a relativist code. So to unpack that a little bit more. So for a knowledge code, knowledge as opposed to knower attributes is considered to be the basis of achievement. And for a knower code, the knower's attributes are emphasized above specialized knowledge. For a relativist code, and the basis of achievement is neither knowledge nor knower. So it's an anything goes code. And in an elite code, both knower and knowledge attributes are the basis of legitimation. So the data from my PhD study showed that the RNID has a knower code. So in order to understand more about the coding orientation of the RNID knower, I looked to critical discourse analysis. And I used G's theory of language in use, which provides building tasks and tools to allow us to study the coding orientation of agents in a field. So we can study the being, saying, and doing of agents in a field and how they use their being, saying, and doing to maximize their position in a field. So in terms of data analysis, and for extant text, I analysed the intellectual disability nursing literature. And I also analysed the Nursing and Midwifery Board of Ireland standards and requirements for nurse education programmes. And these are the statutory regulations that all third level nursing degrees have to meet to provide nursing degrees in Ireland. So my researcher generated texts include interviews with 5 ID program chairs across the country, universities and institutes of technology. And then I interviewed on one program practice-based educators and university-based educators and students, ID nursing students. So in this presentation, I'm just going to talk briefly about 2 building tasks. So G offers building tasks to allow us to see what agents in a field are building. So I'm going to look at identity and connections here. And in order to see what agents are building, G offers tools of inquiry. So some of the important tools of inquiry in this study were figured worlds. So for example, ID nursing has a figured world of that there are enhanced attributes in ID nursing that don't exist in other nursing divisions. But it's a figured world because the evidence to support this is left wanting. So social languages in ID nursing. The medical or the social model of disability and person-centered language is very important in ID nursing. The medical model language and use of the word patient and the language of suffering is rejected in ID nursing. A very important part of my research was discourses, and I mapped about 20 discourses in ID nursing and in ID nurse education. So an example of some of these discourses were advocacy, supportive nurse-person relationship, person-centered approaches, and supporting varied needs. So these discourses helped me to learn more about the knower, the RNID knower. And they also helped me to learn more about the type of knower that the ID nurse is. So the types of knowers can be explained in terms of gazes. So Bernstein describes a gaze as a particular mode of recognizing and realizing what counts as authentic reality. And Mayton advanced this concept by conceptualizing 4 different types of gaze in knowers. So again, we have social relations here. So we have relatively stronger social relations, relatively weaker social relations. So at this end, we have a born gaze. So that would be, say somebody is born with an ear for music. It's something they're born with, but they, you know, it may not be able to be taught in the same way. And at the opposite end, with weaker social relations, we have a trained gaze. So these may be attributes that can be just taught to anybody, and it doesn't matter who the person is. So the data from my study showed that the cultivated gaze is the most appropriate gaze for the RNID knower. So with a cultivated gaze, what should exist is a contracting range of well-theorized and recognized attributes. And this is the problem in ID nursing, that there isn't a collection of well-theorized and recognized attributes. From the data, what educators and students found was that there's a series of unarticulated gazes in ID nursing. And this leads to fragmentation and role confusion. And it causes a problem for students trying to develop their ID attributes during their program of education. So again, back to the discourses that played a very important role in identifying the unarticulated gazes. Some of the current discourses may not be helpful in ID nursing, and just two examples, there are many, but 2 examples are, as I mentioned already, the enhanced attributes of the RNID. And it would appear that some of these enhanced attributes are indeed shared with many other divisions of nursing. And another discourse is the marginal division of nursing. So the ID nursing has a discourse around that it is marginal within the wider world of nursing. And this discourse has been recontextualized to students. So both of these discourses, there are the features of that there are shared attributes with the wider world of nursing, and it may be more beneficial to connect with other nursing divisions than to stay in this marginal position and to recontextualize the discourse to students. And just one example of a shared struggle within the marginal division of nursing discourse is developing the voice of ID nursing. So that's a very strong piece of that discourse. But developing the voice of nursing is actually a shared struggle. And again, it may be more beneficial to join with other divisions of nursing to develop the voice of nursing and to work, you know, in a kind of more connected manner. The data showed that there were features to ID nursing that are unique, but they need to be researched further. So one is networking. So although networking exists in many nursing divisions, there's a particular pattern across many different channels that ID nurses use to meet the health and social care needs of people with an intellectual disability. Also, the supportive nurse-person relationship discourse is common across many divisions of nursing, but there is within ID nursing a foundational and functional facet that may be unique to ID nursing. So for example, if we have, say, for example, Jane is a person who has an intellectual disability and she needs to go for a dental checkup. And she works with an RNID, and the RNID knows Jane over many years. She knows what Jane likes and dislikes. She knows what will help Jane in this situation and what will stress her out more. So she uses her foundational knowledge of knowing Jane to provide support, functional support in making this dental appointment as stress-free as possible for Jane. So that's just one example, but both of these features need to be researched further. So by researching these attributes further, this is how we will create a range of well-recognized and theorized attributes, both for ID nurses, for educators, and ultimately for students to allow them the opportunity to develop their ID disposition and to address this, the issue of ambiguity in relation to attributes. So a limitation of this study is that some of the extant data or the researcher generated data came from just one program. So there's the potential there to look to wider in Ireland and also to the UK to get more data and research it. So to conclude, I looked at the issue of students' struggles to build their RNID disposition, and I used LCT and CDA to learn more about the ID disposition and the cultivation of the RNID gaze. And then I signposted for further research that is needed around the attributes of the RNID. Thank you very much for listening.
Oh, thank you, Liz. That was great. It's really very interesting to hear about your research in greater detail, and it's such important research as well. I had a couple of questions. My first question was because I used to have in my culture module some of the undergraduates for intellectual disability, and I think they found the theory very difficult. Now they're actually not part of that module, but it leads me to think about the role of culture. And so you were thinking about that Ireland and the UK are the only places that have this undergraduate. Is there a cultural dynamic that's part of this in terms of education for undergraduates?
Well, at the moment, the reason why it's just Ireland, several other countries had intellectual disability nursing, but they've stopped training undergraduate nurses. But I think there is a cultural aspect to the fact it's only Ireland and the UK that are educating undergraduates. So I think maybe, yeah, it is, because say if you look to America, I think they would have, I think they would call it developmental disabilities or something like that, but it'd be all at a kind of a postgraduate level. So I mean, there definitely is. I think we're quite limited to maybe Ireland and UK in terms of the experience of providing an undergraduate program in ID nursing at the moment.
So thinking about what that means for the students at an undergraduate level versus a postgraduate
absolutely
sort of thing.
Absolutely.
So the idea being that there's a vision that the knowledge that you have to be a nurse first and then you can specialize which we have taken a position that this can be part of being a nurse, and it should be part of understanding that from the very beginning.
Absolutely. And I mean, I think that I think some of the student struggles is they have so much to make sense of. I think it can be difficult, and yeah, absolutely there, you know, that where nursing fits, where sociology fits, where psychology fits, and how they all, you know, come together and how they will all be needed. Sometimes the students, I think, you know, they may be doing a piece from psychology and they'd be saying, you know, I don't need this as an ID nurse. And then, but if they have worked as an ID nurse for a couple of years, they'll say, I absolutely do need this, and they may be able to engage with it better. So sometimes I think the curriculum can be so big that students can struggle in, you know, in that way.
I had one other question, and then Mary has a question as well. My other question you alluded to when you were talking about difference in terminology in North America, but I was also thinking about related nursing care such as dementia, which is expanding. And so the specialisms, do they translate in terms of
that crossover part? I mean, I think, you know, I talked about the enhanced attributes of the ID nurse. Like those enhanced attributes, I'm sure exist in, like, as you say, areas like dementia care. There are huge crossovers, and, you know, instead of reinventing wheels, I think it's important for ID nursing to make those collaborations and connections with other aspects of nursing, you know, and I think that's, you know, an important bit to the future.
That's connected to Mary's question. She was asking for, she asked, what are the enhanced attributes of the ID nurse in the discourse?
So, I mean, the discourse is that both educators and students are using the discourse, but if you ask somebody to explain what are the enhanced attributes, they remain in a kind of an esoteric or unarticulated way. You know, it might be more that RNIDs make a huge difference, and what would we do if we didn't have RNIDs, but it doesn't actually get into maybe the coding or the clear explanation of what the attributes are. And that's an area that really needs to be clearly researched for everybody involved.
I think it's fascinating what you're doing, and I would love to see those students come back to my culture classes, but I understand that it can be just another layer of trying to deal with things. But potentially, though, we also look at the cultural variation and difference that is happening in Ireland, where they interact with people from different cultures. So thank you so much, Liz, and thanks everybody for this morning. We're going to take a break for lunch. The plan was to come back at 2 o'clock. We have our final session from 2 to 3:40. I hope you'll all come back and be part of our final discussions, because this morning has been absolutely wonderful. I've enjoyed it tremendously, and I hope all of you have. Thank you so much to Justin and Mary, who are in the background here helping and making sure everything goes really well. But I think, and to all of the speakers this morning, and come back, because we have 3 more, well, at least 2 more, and my talk as well this afternoon. So we'll leave now and come back for 2 o'clock. Okay.